Welcome to Cancer-Related Fatigue Essentials. This is the first of 3 learning modules for medical, nursing and allied health professionals. This content is based on current guidelines, literature and end user advice. Module 1 is about the features of cancer-related fatigue, or CRF, consumer experience and risk factors for cancer-related fatigue. And I'll introduce a clinical guideline. The US National Comprehensive Cancer Network defines CRF as a persistent feeling of tiredness related to cancer or cancer treatment. Unlike the typical fatigue that healthy people experience, it can't be explained by recent exertion and is not relieved by rest or sleep. It can come on suddenly, is distressing and affects everyday activities. CRF is more than just a physical sensation of tiredness. It can affect thinking, tasks, behaviours and emotions. People with CRF describe problems remembering and making decisions and struggling to start or finish things. Describing fatigue, people often talk about tiredness or a lack of energy, or other terms including weak or lazy. One man told me, "The best way I can describe it is, I've lost my oomph."
My fatigue affected me in a way that I used to get up in the morning feeling fine, but halfway through the day, all my energy was depleted. I could only get through half a day at work, and I would have to go home and just rest so that I could make it through that day and get ready for the next day. Fatigue is not always the same for me. I used to go down to the train station and I just couldn't comprehend what I had to do. I used to go to the normal platform where I go. The train was there, but I just didn't know what to do. I couldn't compute that if I got on that train, go to my normal stop and get off, and that was it. And that was my fatigue. But there's also a friend of mine whose son has severe fatigue, and he can't get up in the morning. Some mornings he just cannot get up, and he's just sort of bedridden, if you will. He's also too tired sometimes even to play video games. His condition was really, it really impacted the family quite severely, because he would be in his room unable to do anything for himself, and his mother used to be in the kitchen, preparing meals for someone else, for the rest of the family, and he needed something to be done, whatever it was, and the mum would ask the sister to do it, and the sister, not understanding the impact of what the fatigue had on him, she would get annoyed with him and say, it's about time you get up and do things for yourself, not realizing what it is. And of course that affected the whole family. It put a lot of stress on the relationships within the family, and they really had to struggle to keep themselves together. So the first time that I was impacted by fatigue, I had no idea what it was. I thought, I don't know what's happening to me. I thought on bad days, I thought to myself, has this cancer gone to my brain? Has it affected my brain, that it's stopping my brain from working properly? I really got concerned. I thought to myself, I can't do certain things anymore. I can't get through my whole day anymore. And that became distressing. I thought I was losing my mind. As I said, I was going at the train station. I had no idea what was happening to me. I didn't know if it was part of the treatment, part of cancer, or if I was just losing my marbles. It was, as I said, it was distressing.
Prevalence of CRF varies according to the cancer diagnosis, treatment phase and how it's measured. Let's focus on moderate to severe fatigue prevalence. These approximate ratios are based on 2 large studies. From these studies and other findings, roughly half of mixed ambulatory cancer patients and people having treatment may be experiencing moderate or higher fatigue. In survivors with no detectable disease, about 1 in 3 have significant persistent fatigue, affecting work capacity. And around 2/3 of people with advanced cancer could have moderate to severe fatigue. For details, see the evidence appendix. There are quite a few theories about what causes cancer fatigue. Given that people are affected differently, it's likely that several factors combine to cause fatigue, but the mechanisms are still unclear. Most theories point to cytokines playing a role via inflammation, endocrine changes, or processes acting at a muscle cell level. See the 2018 review by O'Higgins and colleagues if you want to know more. Although cancer and cancer treatments contribute to fatigue, there are other factors that increase your risk, shown on this chart. People with pre-treatment fatigue, depression, multiple or chronic conditions are at greatest risk for more severe fatigue. Additionally, physically inactive people are particularly vulnerable. Acute onset fatigue can be a sign of a change in medical condition. A critical appraisal of 4 cancer fatigue guidelines recommended a Canadian guideline for use worldwide. The Canadian Association of Psychosocial Oncology guideline, CAPO for short, has a robust evidence base. It's applicable to all diagnoses and stages of the cancer journey. At Peter Mac, we're using the CAPO with a new clinical toolkit to help apply it. Cancer Fatigue Modules 2 and 3 will focus on the CAPO guideline and toolkit in practice.
Health professionals can really help people deal with fatigue if they can ask about fatigue, whether they are experiencing fatigue, identify that they are actually experiencing fatigue and that something can be done about it. The second thing that they can do is to tell me what fatigue is and explain to me in simple terms what fatigue is and how it affects me, and if it's a long-term effect or if it will actually pass, if things can get better, or if I can do something to actually combat the fatigue. Also, to be reassuring about a patient's fatigue is an example is my friend's son who has severe fatigue. He asked his mother if the severe fatigue is what death feels like. And it would have helped me to know that fatigue is real. It is something that some people, some patients do have. And it would have helped me a lot. It would have given me a more positive frame of mind if I had known that my fatigue would reduce and my brain functions and everything would come back to normal. And finally, it would be reassuring to know that doctors would actually note down the fatigue. Once it's been identified, note it down so that my whole medical team, be it the oncologist, the doctors, the nurses, my GP, would all know about it, that it is something real and that they can all tell me about it. It would make me feel a lot more positive if everyone is aware of it.
You've reached the end of Module 1. See you soon.